And so now with this program, when a person is admitted to emergency departments due to alcohol or drugs, they'll be connected with a recovery coach, who will let them know that they're there to help them, and that they can make it to the other side of the struggles that they're experiencing, and they too can experience long-term recovery. The trained coaches that are here today and that are part of this initiative are individuals with lived experience. They're people who, with treatment and support, are now living in recovery, are now giving people hope, are active, are advocates, are wonderful partners. It's been a pleasure for me to get to know and to work with them. And so I thank them for their courage, for their commitment, for their dedication, for really being willing to step in and work with people during this really difficult, challenging time, and to walk alongside them as they move along in their recovery journey. I can't describe how happy I am, really, and how thrilled I am about this partnership. It's a partnership that came about as a result of really ongoing discussions at forums with community members, with recovery coaches, with L&M. People really saying that this is a vital window, a vital period of time in which we can intervene. And so it's a pleasure, really, to be able to implement this initiative now. And so none of this would be possible, of course, without certainly L&M, but also CCAR, so the Connecticut Community for Addiction Recovery. For nearly 20 years now, CCAR has provided recovery support services to people throughout Connecticut, helping people in recovery live fulfilling lives. And many of those people ultimately volunteer at CCAR and continue to help other people. In addition to helping people with substance use disorders, they've also trained about 1,000 recovery coaches, and many of these recovery coaches are working alongside other people. We recently received SAMHSA funding, and we're excited about expanding recovery coaches around the state. At this time, I'd like to introduce Rebecca Allen, who is the Director of Recovery Support Services at CCAR, and I'd like to invite her to say a few words. Rebecca?
Hi, good morning, everybody. My name is Rebecca Allen, and I am the Director of Recovery Support Services for CCAR, and I'm also a person in long-term recovery. I have been in recovery now for over 19 years, and my drug of choice was heroin. So this conversation is very personal. So CCAR has been providing services in Connecticut since 1998, and we're really, really excited to be offering the recovery coaches to the emergency departments. So since 2009, when we started training recovery coaches, nationally and internationally, our curriculum has been used to train over 12,000 coaches. So like the commissioner said, we have about 1,000 that we've trained in Connecticut, but nationally and now even internationally, we've trained over 12,000. So a recovery coach is somebody with lived experience that will go in and will sit with somebody and have that conversation with them. Provide that ear for them to talk to openly and honestly about what they want to do. The recovery coach has a comprehensive resource guide that they use, and it has statewide resources for detoxes, inpatient programs, medicated assisted treatment, and even community recovery supports. So our coaches know who to call. They have a name and a number to reach out to. They know what programs accept what types of insurances and things like that. So they're able to really sit with that person and walk them through the process. It can be difficult sometimes to access treatment, and it's usually not because there's not beds available. There are beds available, but it can be a long process, and it can be frustrating for people. So when people are presenting to the emergency department as a result of an overdose or other alcohol or drug-related medical emergency, they're at a really vulnerable spot, and it's really a time to have, to intervene and to get that person to the appropriate level of care. So that's what a recovery coach is really there for. They're there for that patient, to sit with them, to get them to work with them, and to get them to the appropriate level of care. So I'm going to introduce Jennifer Chadukowicz. She is our Emergency Department Recovery Coach Manager, and she can talk a little bit about how this program has been, playing out so far in the Emergency Department. So Jennifer?
Good morning, everyone. Thank you, Bruce, and thank you, Commissioner, for having hope alongside us. We are very grateful for your support. My name is Jennifer Chadukowicz. I am the Emergency Department Recovery Coach Manager, and in addition to that, I'm also a woman in long-term recovery. I've been clean and sober since June 30th, 1988. I'm very grateful that I've been able to blend my management background and my recovery background to be able to bring a program like this to Connecticut and especially to these hospitals and EDs. Thank you for letting us serve. It's a privilege to be able to lead this program in the emergency departments in Eastern Connecticut. Our emergency department recovery coaches, who are right here, they'll wave to you, David, Katie, and Jay, have seen remarkable results in such a short period of time. We've been in the emergency departments now for just a handful of weeks, and we have been able to connect over 43 people to recovery. 9 of those people we've gotten directly into inpatient services. 25 of them we've connected to detox and then onward to longer recovery care. 6 of those people we've been able to connect to outpatient IOP programs because that's what worked for their lifestyle. 2 directly into medicated assisted therapy programs, and 1 to a CCAR community recovery center. We've had over 350 phone conversations with these 43 people. Recoveries, we call them, checking in with our coaches on a regular basis, having meaningful conversations, inspiring hope, removing barriers to recovery, and offering encouragement and support. One particular gentleman that we helped touched a note with all of us. We encountered him on a Sunday evening. He was being discharged from a hospital at 8 p.m. and was not welcome to go home to his house. And through our coaches advocating for him, encouraging him to make healthy decisions for his life, we were able to work with him not just one day, but we worked with him Monday to remove barriers, Tuesday to remove barriers, Wednesday to remove barriers, Thursday to remove barriers, and finally Friday, he was admitted into an inpatient program. What I want to share is that without the support of these 3 coaches, he would have given up Sunday night, Monday, Tuesday, Wednesday, and Thursday. He's still an inpatient, and every time he can get near a phone, he calls the coaches to say how great he's doing and how happy he is and how excited he is for his future. I have 42 more stories like that, and I would love to share them all with you, but I don't have time. I want to thank the Commissioner for believing in recovery coaching. I want to thank CCAR for having the vision for recovery coach so long ago. I want to thank the hospital administration for trusting us to take care of their patients. And I want to thank these recovery coaches for serving. This is our job, it's our career, but it's also a joy and a privilege, and we treat it as such. Thank you very much. And I'd like to introduce the Chief of Emergency Medicine, our boss here at this hospital, Dr. Mayorga.
I am honored to be here today actually representing the staff of the emergency department here, our doctors, nurses, all the technicians and support staff that make it possible to actually provide the highest quality emergency care for anyone that comes through our doors 24/7. And as you've heard today, the opioid epidemic is not going away anytime soon. And so the resources that we need to dedicate to these individuals who are at a teachable moment when they're in the emergency department is extremely important. And so, you know, the opioid epidemic certainly transcends all socioeconomic status, race, religion, and we are seeing many, many young individuals who are affected, and actually their life is ended when they're not receiving appropriate care and treatment. And so, as mentioned, New London does have a significant problem with substance abuse and dependence, and we very much welcome this partnership with CCAR as part of a multimodal strategy to try to help these individuals with recovery and care. So no longer are we just going to address their emergency issues. We're going to look at the larger complexity of their issues. So thank you very much for the CCAR coaches starting. We're very excited, and thank you for all the support from everybody here. And please let us know what we can do to help as clinicians in the ED. Thank you.
Great, thank you. And again, we're just so pleased to be able to announce the launch of this initiative formally. And again, I thank all of our partners, L&M Hospital, Bruce Cummings, Dr. Mayorga, the CCAR team, our recovery coaches. This has really just been a wonderful initiative to be able to launch now, and we're excited about continuing to evolve and grow it. And again, so thank you everyone for coming. And I'm happy to take a few questions at this time. Yes.
You made a reference to SAMHSA funding.
Yes.
Can you provide some details on that? And I think there are 3 other hospitals.
Yes. Yep. So there are 3 other hospitals. So there's Manchester Memorial, Wyndham Hospital, and also Backus Hospital. And so, we are looking through our SAMHSA funding. So we did recently receive $5.5 million each year for 2 years as part of the 21st Century Cures Act. That was funding that was awarded to all states. And so part of what we're looking to do with that funding is to increase the recovery coaches both in emergency departments, but also in medicated assisted treatment programs, and really throughout our system. So this is an area that's a priority for us. We know that recovery is possible. And our recovery coaches, you saw the sort of passion and dedication they have, but they help to bring hope, and they help people to see that recovery is possible. So thank you.
So the SAMHSA funds are paying for this program here at L&M?
Yes, yeah. So it's SAMHSA through our block grant funding. So we get SAMHSA block grant funding, and so yeah. Any other?
Did you say the 4 hospitals that are doing this, and what are they, and then will this expand to other emergency departments throughout the state?
Yeah, so that is our intention, to continue to evolve and expand this initiative. The other hospitals right now are Manchester Hospital, Wyndham, and Backus Hospital. And at Backus Hospital, we also have a different initiative, but somewhat connected, where our crisis response workers are also connected with the emergency departments. So they're part of the team as well. Yes.
I know in the opioid crisis, well, it's been going on for decades.
Yeah.
More recently, there have been, concerns about it, and a lot of overdoses seen here at this hospital. Some of the people who try to get people help said that there aren't a lot of beds, that they'll call and they can't get a bed for those who are seeking it. So is that still a situation, or has that gotten better?
It's something that we're looking at and we're working on daily. The Connecticut system is a little bit complicated in that, there's, DEMIS, we work with individuals who are on Medicaid or who are underinsured. Often when we look at our beds within our system, we're right around 98, 96%. On any given day, we often have a bed available. It may not be in the town where the individual lives, so they may have to travel. When there are instances when we're at 100%, we do try to connect the person with other supportive services while we're waiting for a bed. And so that has been our approach, and it's been key for us to develop a series of services and supports in addition to beds. And I think that's an important message that we've been trying to get out. The beds are one part of helping a person move into recovery, but it's certainly not the only part. And for many people, a bed isn't what's clinically appropriate. And so it's really important for folks to get the necessary assessment to then be linked with the appropriate level of care. So, thank you.
It's been going for a few weeks. Can you be a little more specific on the time and how it actually works when an overdose patient is brought in? At what point the recovery coach comes, and how that
Yeah.
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 Just how it works.
Yeah, and so it's been about a month now, right? Yeah, about a month. Certainly has been part of our vision for probably about 2 years or more. Probably not that long, but a while. And so, how it works, and certainly other folks can chime in as well. When somebody is brought to an emergency department, the emergency department will contact CCAR, and then CCAR meets with the individual who has been brought in. Often they're on site, so in some instances they're right down the hall. If they're not right down the hall, then they, can be called and come to the hospital and then meet with the person.
24/7, this is going to be.
This is around the, yeah.
I would be
Come on.
happy to
Yeah.
talk about the details.
Yeah.
So our coaches are Monday, 7 days a week, Monday through Sunday, 8 a.m. until midnight. So they're covering those 2 shifts. What happens when a person presents to the emergency department, the staff will ask them if they'd like to talk to a recovery coach. If they say yes, they call a dispatch number, and one of our coaches that's on shift will meet that person in the emergency department. There's a 2-hour window. Unfortunately, we have one coach that is covering all the hospitals, so, they may meet with somebody in Willimantic or Wyndham Hospital and then have to go to Manchester or down to New London. So, they're very busy during their shift.
What if someone says no?
If somebody says no, so we, within the next couple of weeks, we're going to have a resource for the emergency department. It's a little, small piece of paper that has resources for that person. And the thought is that if that person doesn't want to meet with a recovery coach, that the ED staff could give them that piece of paper with resources that they could take with them.
Sure. Actually, we had a gentleman that was presented and was asked if he wanted a recovery coach, and he said no. And he left the ED, and then he came back to the ED the next day and changed his mind, and we started working with him at that point. So a lot of what we do is we plant seeds of hope, and people may not grab on day one, but that's okay, because we work 365 days a year, and we will be there. So it's already worked. That scenario has already presented itself. And so we've gotten hope that, all right, this person, they didn't want it at the time, but then they came all the way back to the ED the next day. So it's turned out to be a wonderful story. Thanks.
Thank you. Any other questions? And thank you. Thank you. No. Okay, great. Thank you very much. Thank you.